What is the morphology criteria for diagnosing ventricular tachycardia? For morphology criteria, you have to look into V1 to V2 and V6. These are the important areas, V1 to V2 and V6. Then based on the appearance of the QRS complex in the V1, we can classify into two. The morphology criteria has two sets. One is the dominant R wave in the V1 and the second one is the dominant S wave in the V1. If you find dominant R wave in the V1, then you have to look for the criteria for RBBB like morphology. For dominant S wave in the V1, you have to look for the criteria for LBBB like morphology. Let's talk about the first one. You identified a dominant R wave in the V1. So a positive R wave in the V1, and sometimes it can be monophasic appearance, sometimes there will be a notch can be present, sometimes there will be the presence of a QR complex, that means a small Q wave and a tall R wave. These are all indicative of ventricular tachycardia. Now in V6, what is the appearance? In V6, there is a presence of a QS complex. Q is a negative deflection, S is a negative deflection, that means a complete negative deflection in the V6 without the presence of an R wave. That is an indicative of ventricular tachycardia. Now what to do if a dominant S wave is present on the V1, then you have to look for the criteria of LBBB like morphology. So what is that? I will explain in the next video.